Okay. Hello. We are live. I'm just going to give it a few minutes so we can get everybody else joining us.
It's fine.
Okay, good morning, good afternoon, and good evening, my fellow global citizens. Happy holidays and welcome, and thank you for joining us for our last episode of the Global Youth Mental Health Awareness Show 2020, where we'll have open conversations with the youth about mental health. And today, I'm so excited. The topic is so amazing. I'm your host, Katinda Dola, messenger of love and hope, and the author of the Big Comeback book. In today's show, we are so blessed to be in the presence of two fabulous panelists. We've got two others who are joining us a bit later. So our first panelist is someone you've seen on the show before. That's Edwin Gitau. Edwin is a certified addiction psychologist, founding director at Tuhai Center, and a global goodwill ambassador. Hello and welcome to the show, Edwin.
Hello, everybody. It's another amazing Thursday. I'm glad to be here. We're going to learn. Thank you.
Thank you. And our second panelist is Xavier. Okay, I better make sure I've got the right name here. Is Xavier Sunday Effiong. Xavier is a psychologist and also a volunteer at the Global Youth Mental Health Awareness. Hello, good morning, and welcome to the show, Xavier.
Good morning, Katinda. Good morning, everyone. It's another wonderful session. We'll be dissecting all the issues that is, disturbing mostly the youth in the nation. Thank you so much for this wonderful moment. Really happy.
Thank you. So in our conversation today, we will be educating and sharing some insights and answering the question, what are the evidence-based scientific principles in management of chemical addiction? But before we start our conversation, I'd like to know, how are we feeling today, Xavier and Edwin?
Okay,
Xavier, go.
I'm feeling fine. Yeah, I'm in Nigeria here. I traveled down to Akwa Ibom State. I know you've heard of that before. Okay, so it's the weather is fine here and somewhat sunny and hot as well, but it's fine. It's cool. We've developed a very thick skin to accommodate such, so we are really good. Thank you.
Thank you. How about Edwin? How are you feeling today?
Thank you very much, Katinda. Thank you very much, Xavier, and our viewers. Today I'm feeling super excited, and over and above that, we are already in the holiday mood here in Kenya. Recently, in the recent three days back, we celebrated Independence Day, and moving forward, we have Christmas, so it is in the celebratory mood. Thank you, Katinda, for asking.
Thank you so much. So in our show last week, we brought to light why addiction is a family and community disease and how it affects our communities socially, economically, and psychologically. So I'm just going to say something before we continue. So I'm just going to talk about what is drug abuse, just to give people a bit of a recap from last week. So what is drug addiction or substance abuse? So substance abuse is when you take drugs that are not legal. It's also when you use alcohol, prescription medicine, and other legal substances too much or in the wrong way. Substance abuse differs from addiction, and many people with substance abuse problems are able to quit or can change their unhealthy behavior. Addiction, on the other hand, is a disease, and it means you can't stop using even when your condition causes you harm to yourself. Commonly abused drugs are both legal and illegal. So what are the evidence-based scientific principles in management of chemical addiction? And so Edwin or Xavier, who wants to tackle that? And maybe just give us an idea, what is an example of chemical addiction?
Okay, let me go first. Mm, am I good to go?
Yes, go ahead.
Good. So, thank you, Katinda, for this wonderful opportunity. Speaking about chemical addiction, I would say that chemical addiction is simply characterized by a compulsive and a continued use of chemical substances despite harmful consequences caused to the addict. So this person tends to be in this compulsion. You know what is compulsion? Repetitive acts despite its its consequences. So the person tends to be engaged in this illicit act of using these substances or chemical substances despite the effect it's causing to him or her. So speaking about the scientific best principles in the management of chemical addiction, we see that before we could have an effective treatment for a chemical addiction, there are certain principles in which the psychologist or the psychiatrist or whoever that is administering the treatment should follow for such treatment to be effective. So I have few of them here. I think I have like five of such principles, although they are elaborate and they are much, but I've been able to pick out five of them which are very indispensable for an effective treatment. So first, I would say that the treatment needs to be readily available. That is one thing. That's one principle that has to be followed. The treatment has to be readily available. You can see that these persons or these addicts most times do not want to receive this treatment, or sometimes do not even believe that they are suffering from this. So for them to receive treatment is a very hard nut to crack. So the little time we've been able to persuade them and give them more reasons to come for treatment, and they come, there must be treatment, or there must be treatment options available at that time, so we could utilize our opportunities so well. Okay, then secondly, I'll say that effective treatment should address the client's psychological need, social need, related medical needs, or issues. Also we can see rehabilitation needs as well. So what I'm trying to say is that when we are administering treatment to this chemical dependent or chemical addict, the treatment should not just focus on just drug issues, but we should try as much as possible to see how this treatment could also cover other related medical issues, related medical, related psychological problems, social problems. How are these people able to fit into the society once back? How can they be able to fit into the family once back? And so that is the main or the summary. We should try as much as possible to cover up other problems, not only the drug addiction issue. So I'll go to number three, or the third one, which is remaining in the treatment for an adequate number of time. So we from empirical evidence, we've seen that for drug addiction treatment to be effective, there has to be an ample time for the treatment. What I mean by this is that there should be an adequate number of months for this treatment to be effective. So we should make sure that the patients or the clients remain on this treatment throughout this period. Yet, just like since we know that addiction is just normal illness, like we have hepatitis, we have HIV, and other issues, which it responds to treatment accordingly. So just like in HIV and AIDS, so when you skip they needed dose for the day or for the week, and then after a week you now go back, you see that there is bound to be relapse. So same thing occurs in drug addiction or in a drug addiction treatment. So when once this person starts this treatment, and later on he or she defaults or stops halfway, there tends to be relapse and tends to be problems. So to have an effective treatment, we should make sure that the person remains on this treatment over for an adequate number of time for the aim, goal to be achieved. So I'll go to the next one, that possibly drug use during treatment must be monitored continuously. You can see that um, as drug addicts, you telling them not to be taking the drugs, it's a hard nut for them to crack. So even when they agreed not to, and you're administering treatment to them, you have to monitor them. You have to monitor and you have to check and see if they are still taking these drugs. That can be done through various ways. You can use urine analysis, you can use blood analysis, and the rest, and even heart-to-heart talk with him or her. So we should try as much as possible to see if this person is still going back to these drugs. And if that is done, we'll be able to know, where we are going, or if the treatment is effective. Because if you are still giving him treatment and he is still going back to take these substances, the treatment might not be that effective as it's supposed to be. So there should be adequate monitoring of this treatment. So lastly, I would say that in the treatment of chemical addiction, that medical or medications are very important. Yes, they are very, very crucial. They are very, very critical, and it will be more effective if it is backed up. If it's backed up with other behavioral therapies, other counseling, or other psychological intervention as well. Which will really crown it all and make it a wonderful treatment. Thank you so much. I believe I've been able to tackle the question very well. Thank you.
Thank you, Xavier, for that. What about Edwin? What would you like to add to that?
Thank you very much, Katinda, for this opportunity. And it's a great moment that we are enlightening our citizens on the way issues or things should be done when it comes to addiction and the challenges that we have at hand. I'll begin by saying that for sure, addiction is a disease. It is a brain disease. It's a disorder that normally happens when we are not able to prevent once it escalates from the prevention. And today we are discussing about scientific and evidence-based practices that have been universally accepted in the management of alcohol, drug, and substance abuse. So I would want us to begin with we start look at it from the scientifically proven ways. And when we talk of scientific, we mean something that has been agreed upon, something that has been researched, something that has been tried and tested in various environments, not a one-man show. It is something that where you collect data, you analyze that data, you present that data so that it can be accepted, something that has been taken through different environments. This is the scientific approach that we are using. I mean, we are saying that of late, like we have had the current situation that we are in, the pandemic we are in, there are some approaches to handling COVID-19 that have not been scientifically proven. If you can recall, when the outbreak came, we were being told that there were some versions that you can cure COVID through taking alcohol. You can cure COVID through sunbathing. But it is not scientifically proven. The scientific proof that we have right now is that a 70% alcohol-based hand sanitizer kills the viruses, something that has been tried, tested, and it has been accepted. These are the principles that we are applying now. We are going to discuss today. So, in short, I would want us to have a look at the management and the guiding principles in the addiction, drug and substance abuse and addiction. And we start by talking about drug demand reduction. This is the prevention. What are the scientific and evidence-based prevention practices that have been approved? Then from there moving forward, we look at treatment. What are the evidence-based practices of treatment? Just like my brother, my panelist brother Xavier mentioned, we have evidence-based practices in treatment. We have evidence-based practices in prevention. We have evidence-based practices in rehabilitation. There are things that are commonly shared, but they are not scientifically proven. So today we are going to talk on, like if we start with the prevention interventions, what are those evidence-based practices that are confirmed. In my country, where in my cultural setup, Katinda and Xavier, it is we had that perception that once somebody is having a diseases like measles, a child could be washed with a local brew and the child gets cured. But that one is not scientifically proven. We had that perception that if you drink a little bit of wine, it's going to clean the uterus and the baby will be born in a fair complexion. That is not scientifically proven. So today we are going to demystify the myths, the things that are not true, which are not scientifically. Now, to begin with, when I go to the prevention, the scientific-based prevention practices, we start our prevention as early as during pregnancy. When the mother is expectant, that lady should not indulge in alcohol, drugs, or any type of medication unless and until approved by a physician. That is because science has proven that if you take alcohol during pregnancy, there are chances that this child, the fetus, will grow with deformities. There is something we call fetal alcohol syndrome, whereby you find children are being born with birth defects. Sometimes you'll find cleft palate, others you'll find folded arms, because science has found that if you drink or you smoke cigarette or marijuana, you're going to affect the unborn baby. Then from birth, that child should not be introduced in an environment that is with alcohol, drug, and substances. These are the scientifically proven prevention practices during the early or the formative years, during the early childhood, during adolescence. We've been told that there are some practices that we do. If I now started sharing scary messages and videos about diseases, this is not a prevention practice. In any case, it escalates the situation. So these are the prevention, the evidence-based practices in prevention. When we go to evidence-based practices in treatment, the same case applies. In short, we have some examples whereby when it comes to treatment of persons with substance use disorders, we use a multiple approach. We use, first and foremost, there is the spiritual aspect. We have to make it very holistic. Then secondly, there is the pharmacotherapy. Pharmacotherapy is nothing but when you use pharmaceuticals or drugs, other drugs in treatment, like we have methadone replacement method, like we have disulfiram, we have Suboxone. All these drugs, they are used in reducing the withdrawal symptoms. So this is the treatment. This is the treatment, evidence-based practices in treatment. Then we have, just like my brother Xavier mentioned, that we agree that addiction is a complex but treatable disease. We agree that treatment should be readily available. We agree that it is not cast on stone. It may take me 2 weeks to recover, to start recovery. Somebody else may take like 1 year. So that period varies from person, because science, after research has been done, it has been proven that it takes time. So these are the evidence-based practices that we are supposed to work on. Thank you, Katinda.
Thank you. Thank you. I see Dr. Cosmas Miner has joined us. Good morning or good afternoon.
Good afternoon to you. Sorry for that. I couldn't be able to come in, but thank you for the link. I'm actually here in Ukunda. This is Mombasa, south coast of Kenya, and I'm happy to join you now.
Thank you. Thank you. Now, we were just talking about the second question, which was, what are the evidence-based scientific principles in management of chemical addiction? So what would you like to add to that?
Yeah, actually what I would want to add on this is that there is no single treatment that is appropriate when it comes to scientific treatment. And that is, it's not one should be actually appropriate for all individuals. So we need to have a matching treatment settings, of course, interventions and services for each patient because every patient, when it comes to addiction, have their own unique problems and also needs. And therefore, it is critical that we be able not only to treat with one kind of single treatment. And this is why in Mombasa, Kenya, of course, we have started, and even in Nairobi, and I think my senior friend Edwin will allude to this, that we've even started using what we call the harm reduction kind of treatment. We have started methadone in it also for people that are using opiate or heroin. And it's also working. Therefore, as I said, it's nice and important to notice that one single treatment cannot be appropriate for all. Of course, I heard Kibe also say this about the need to have treatment readily available, because if we don't have treatment readily available, it means that we might lose some of our clients to treatment. And it's always important to have all the clients that are using drugs to be able to have a treatment facility so that we can be able to retain and to help them recover from drug addiction.
Thank you.
Yeah, that is my contribution to this.
Thank you, Cosmos. Now we had a fourth guest, and apparently she's not able to connect, but she's able to give us some feedback. So she says, how is drug abuse or dependence diagnosed? And she says a family doctor, psychiatrist, or qualified mental health professional usually diagnoses substance abuse. Clinical findings often depend on the substance abused, the frequency of use, the length of time since last use, and may include weight loss, constant fatigue, red eyes, little concern for hygiene, lab abnormalities, unexpected abnormalities in the heart rate or blood pressure, depression, anxiety, or sleep deprivation as well. So moving forward, that was Tariro Kutadza. She was not able to join us, but she's given us that feedback. Thank you very much. So moving forward, we have question 3, which is, what are the 3 stages of progression in addiction? Edwin, would you like to start that?
Yeah, thank you very much. And maybe to add on to something that maybe we left out and it's very important for our viewers, is to mention that among the evidence-based practices, the scientific and evidence-based practices, it has been researched and found that treatment does not need to be voluntary to be effective. What does that mean? That it is not that one must be willing. Sometimes we have to take our clients, our unwilling clients, and along the way, they'll come out of denial and accept, and the treatment will be effective. Also, it's very important to mention that treatment programs should be a holistic approach, whereby we have the spirituality, we have the behavior, we have the psychological, the psychiatric. It is a collective, it is a package that involves a lot of specialists. In the treatment facility, we have a psychiatrist, we have a medical doctor, we have a spiritual religious leader, we have a psychologist, we have, so that this person we rehabilitate holistically. Now, coming to your question, what is the progression? What is the progression of the disease? How does it occur, and how can we intervene? The progression of this disease begins with, first, the prevention stage. Everybody, like what we are doing today, it's a way of preventing. We are psycho-educating, we are creating awareness, we are sensitizing in a way to prevent. And once it's beyond prevention, then it goes to the next, it progresses to the abuse. Initially, you are preventing from abuse, and then the abuse now sets in. Now, when it comes to it has progressed to the next level, you have to go to treatment. And in the treatment, it's very important for us to understand that the continued use of substances and drugs and alcohol and what have you, the continued use is the one that makes it a mental problem. So it progresses from the prevention, and then there is the treatment. Then beyond treatment is where now we go to, before we go to the next level, there is that harm reduction. My brother Dr. Maina mentioned that. Karibu sana daktari. So the progression moves from the harm reduction, whereby these people are usually exposed to so many dangers. They are at risks, so many harms ahead of them. We have some of them who are hepatitis. There are those who have tuberculosis. There are those who have HIV and AIDS. All sorts. It becomes a problem, a big problem with multiple disorders and diseases. So we first of all move them from the risky areas and bring, that is what we call the harm reduction. Then from there we start the treatment, that is the progression. From there it goes to the next level of rehabilitation. A point to make here is that someone can reverse from the very initial stage. After harm reduction, somebody can recover. There is something we call the wheel of change, whereby somebody, you take him through 3-4 steps, and then he starts recovery and maintains his recovery. Now back to you, Katinda, and I'll allow my brothers to chip in.
Yes, Dr. Cosmos or Xavier, what would you like to add? That was about the 3 stages of progression in addiction.
Yeah, actually, thank you for that also. I'll just want to chip in a bit because my expertise actually is in harm reduction. That is what we do in our local settings here in Mombasa, Kenya. We actually help young people that are addicted to drugs to go the harm reduction way. Harm reduction is actually, as Mr. Kibe has mentioned, harm reduction in Kenya now has gotten a lot of move, and a lot of young people have been introduced into it. And these packages like needle and syringe programs are coming in. These are packages where, of course, rehabilitation is part of it. This is a package of methadone and other packages given to our people through service delivery. But of course, as Mr. Kibe has also said, when it comes to issues of harm reduction, we are not only salvaging one person, but we're salvaging a lot of people, because it involves the community, it involves the parents, it involves the spouses, and therefore it's also a very, very recommendable way to go. Of course, in Kenya, it was very difficult for me to start the harm reduction process, especially when it came to needle and syringe program, because everybody thought, and it's actually the community is still a big fight, and people are asking me, why are you giving people needles? Why did you start the needle and syringe program? And of course, I have to tell people that also to look at the welfare of our individuals that use heroin and using injected syringes. We also need to protect them from HIV and AIDS, and therefore giving them new syringes every day is also very important to add safeguarding them, because when we also helping them go the rehabilitation way, recovery way, we also need to ensure that their health is also looked after. Yeah, that's my take.
Thank you, Cosmos. Xavier, did you have anything to add on to that?
Yes, professionals have said many wonderful things and many educative things, but I would also like to chip in a little. Speaking about addiction as a progressive disease, I would say that addiction, as Dr. Kibe said, we have to view it in a holistic form, just as its cause is also in a holistic way, which is biopsychosocial. It's caused by biological factors are there. We have the social factors and also the psychological factors. So when trying to tackle this, we should try to incorporate all these factors, these three, to having an effective a solution from it. So speaking about the progressive disease of chemical addiction, we see that yes, it is progressive disease because it began from just a simple act of curiosity, to a compulsive issue. So it progresses from one stage to the other. In my own way, in my own research, I've been able to find out different stages of this progression. First, it starts from what? From simple experimentation. The young person just try to experiment. Oh, I would like to test how how a beer could look like, how it feels like. From the experimentation, we now have what? We have regular recreational stage. Okay, maybe next time he goes out for dates, he will just like to have a bottle of beer. And maybe next time he's with friends or he's seeing friends, he just have to love to have a bottle of it. Then maybe now progresses to the next one, which is what? To the problematic stage. Okay, maybe it's having little issues, there are psychological issues, finance issues, maybe marital problems or relationship issues. Just do what? Just try to use some alcohol to forget. Yeah, that's the word, the language most young people use. Use some alcohol to forget the moment, and it still progresses. Yes, we now go to what? To tolerance. After all this consumption, the body system tends to really understand or to really being conversant with this. And there is no effect produced. So the person now has the tendency to do what? To up or to double the dosage. It's still progressing. Now leads to what? To dependence. The person now, because of alcohol, you now have the enthusiasm, the interest in doing some things. At this stage, this person tends to lose interest in many things, except he or she uses these substances. It still progresses to the last of which is addiction, which at this stage you cannot do without. So we can see that addiction is a progressive disease from one stage to the other, and from the next stage to the other, and she gets to what? To the chemical addiction. So that is it. Thank you so much.
Thank you. Now,
Yes.
Edwin and Xavier, you talk about holistic approach. Can you just give us some examples? Because it's easy to hear that, but then what are some examples of holistic approach to drug addiction or chemical addiction?
Thank you. I think I'll take up that one first and say that when we talk of a holistic approach, first and foremost, I would want to mention, for us to understand this, let's go back to the previous question of the stages of progression. And you'll agree with me that the initial stage in drug use is usually experimental, whereby you
Yeah.
find children or young ones at a very tender age, they experiment, they want to imagine how the elders are feeling or they are experiencing, so they want to experiment. Then from there, you find that it is being used socially during a wedding ceremony, during the dowry payment, such like things, social. Then gradually, just like Xavier has mentioned, it goes to the next stage of the habitual. It becomes a habit, and then some will use it as an instrument so that they can be able to function. They cannot work without, and eventually that leads to addiction. Now, let's go back to your question, Katinda. What are we talking to? What are we talking about when we say that it has to be holistic? Number one, when somebody is in substance, alcohol, drug, and substance abuse, he affects all people, or actually it affects 7 people around that person. It affects the parent, it affects the spouse, it affects the children, the employer, the community, the government. There are so many people who are involved in it. And the holistic approach is this behavior or this habit. It makes you to be spiritually. You are not in contact. You are not in any relationship with your creator. You don't have that spiritual life. There is a gap between you don't believe there is that higher power, or you've neglected your spiritual bit. Then from there, there is the emotional. When somebody is in alcohol, drug, and substances habit, or that is already engaged in that disorder, that person does not have a relationship, neither with the mother, neither with the siblings, neither with the children or the spouse. So the emotional bit is already broken. Then from there, we have the physical. You'll find that this person physically is affected. He has medical problems. He is already disoriented. He's dirty. His personality is tainted. So And then psychologically, the mental wellness of that person. So when we talk of a holistic approach, this is whereby we bring all these components together. It is a one-stop shop in a treatment facility whereby you bring in a psychiatrist to check on his mental wellness. You bring in a medical doctor. You do it holistically. You rebuild the relationship between this person and the people around him. You do family therapy where you bring the family members and you negotiate and they come to an understanding that this person was sick. This is the holistic. You bring in a spiritual leader or somebody who can empower this person spiritually so that he can be religious. In short, what I'm saying is this, Katinda. Look at a moving vehicle. It has 4 wheels. If one wheel is deflated, that vehicle will not move on. Suppose now a complete human being has the physical bit, has the emotional bit, has the spiritual bit, and psychological. If this person is emotionally is not emotionally stable, that person cannot. It comes to a stagnation. So when you come to treatment, we inflate. We make sure that all the wheels are balancing. Sad enough is that you may find people who have all the 4 tires flat. The emotional bit, the psychological bit, the physical bit, and you get my point. So this is what
you're saying it's
a holistic
crisis.
approach. Thank you, Katinda.
So what you're saying is a spiritual crisis.
Yeah, spiritual crisis, then emotional crisis, the mental wellness, the psychological wellness, there is a crisis. You cannot, you don't have resources, you can't make money, you're just for the liability. It is a crisis all over. So while we are bringing this back to normalcy, we have to do it holistically. We have to incorporate all the 4 components.
Right. Thank you.
Thank you.
Thank you.
Yeah.
Thank you. I see Tariro Kutaza, you've joined us. Can you hear us? Tariro? Tariro, can you hear us? Okay, she's disappeared. So, Xavier, did you want to add into that, or Cosmos? Do you want to add, or based on a holistic approach to?
I wanted to add to that. Actually, for us at Teen Search for the harm reduction package, holistic approach is basically same as Mr. Kibe's, but ours is actually looked on as number one, the clinical aspect of it. Number 2, of it, and number 3.
Cosmos, we just missed that part. We didn't hear you.
Okay, actually at our drop-in center or our kind of harm reduction, what we do is number 1 is what we call a clinical approach. Then there is the structural approach. Can you hear me?
Yes, we can now.
And there is behavioral approach. So what we do actually at that is the drop-in center. Similar to what Kibe has said, is our approach is also holistic in those 3 aspects. We ensure that, of course, a person who's addicted to drugs gets the 3 approaches: the medical, behavioral, and structural. That is when they come to a place, there is a clinical facility. When they come to a place for structural, they have IGS program, that is income generating. They also have what we call vocational training, that is after, of course, rehabilitation and treatment. And then for medical, I've said it. For behavioral, of course, we expect that this behavior change, and they have places where they can come shower, they can come to our place, and I'm talking of about 200 people daily. They can come to our DIC and have some food, nutritional support, a place to shower, a place to shave, and so that we can change their approach to life. That is when they are clean and modest to be able now to join the other community. We of course do outreaches, we do one-on-one, we have family therapies, and actually it's holistic in that we also include the community members through the barazas of the chiefs, through the community settings, and therefore we try our best to make it as holistic as possible. That is including the medical fraternity, including the counselors, the psychologists, as Mr. Kiba, and others who can help us. Thank you.
Thank you very much. I think I'm just trying to make sure we can take this comment off. It's Looks like a positive comment right there. So just give me one moment.
So, yeah, yeah, like for themselves, one which is my new business partner from Zambia is 24 years old, starts to become the first female president. Mm-hmm. Yeah.
Yes, so it's interesting. So moving on, if you've just joined us, we are talking about addiction and evidence-based scientific principles in management of chemical addiction. So please click, share, comment, and invite your friends to watch and ask questions because this is a topic which affects a lot of families, affects a lot of people in the community. So please click and share because we are here today to just give you some insight on what are some of the things to look out for if you want to support or help yourself as well. Now, moving forward, what is your or our responsibility as a community, and how do we stop the drug addiction, chemical addiction stigma?
Yeah. Can you repeat that?
Okay,
Yeah, customers, go for it.
Can you
go
repeat
first,
it?
sir.
I didn't get it.
We can't hear you very well, customers.
Can you repeat the question, please? Sorry.
Okay. So,
Yeah.
what is your or our responsibility as a community in stopping the stigma for chemical addiction? Like, why are people so afraid to come out to get help, or why do people not talk about it?
Yeah, of course, one of our responsibility as people that help young people and other people come from issues of addiction is even to become good role models and ambassadors to them, because sometimes what we do talks mostly to those who have not started using the drugs. Another thing, of course, is also community education, prevention education in schools and out of schools for young people, not to go to the stage where my friend Xavier talked about the experimental stage. We should actually help young people not to start, not to enter that stage of trying, because that is the stage where they start trying drugs for fun, or maybe to solve some small problems, or just for fun. And these are the stages that we should, when we prevent to educate, we should try outermost to make sure that they do not start experimenting with drugs at an earlier stage. Yeah.
Thank you, Cosmos. Xavier, Edwin, did you want to add into that? How can we
Yeah,
stop
yeah.
stigma?
Okay,
Xavier, you
should
go.
I go first?
Yes,
Okay, that's
Xavier.
fine. Okay, as our responsibilities to putting a stop to addiction in our community, I think education, public education is key. We have to sensitize the whole public of the perils, dangers involved in chemical addiction. Also, we see that parents has a very vital role to play in this issue. Parental monitoring is key also. Speaking about the experimental stage, we see that this occurs at a very young stage or at a very young age. So, if parental monitoring is so strong, this child would have the epitome to try out, to experiment on this drink. So we see that the parent has a very vital role to play in this sense. More so in educational, facilities, mostly during the senior, secondary, the SS classes, and even JS. I think the teachers has vital roles also to play. Children should be taught, or students should be taught other better coping mechanisms or coping ways. How can students cope with issues, emotional problems, or social problems they have maybe with their peers, or other issues related, maybe a failure or exams, or having low grades. It should be taught other better ways of coping with these issues other than using chemical substances. So we see that if this is done, we'll be able to curtail the number of persons engaging in chemical substances daily. So that is my point. Let me give room for Dr. Kibe to add something to that. Thank you.
Sure, Edwin.
Thank you. Thank you very much. Thank you, my brother Cosmas and Xavier. Now, what is our responsibility? What is that a question? What are we supposed to do? Number one, it is an individual responsibility for each one of us, for all the viewers that we have on board and the people around us. It is an individual responsibility for each one of us to prevent from the initiation of drugs and substances. It is my responsibility. Once you make it your individual responsibility, then Katinda takes an individual responsibility. That way, we are going to help in prevention. It is our individual responsibility to prevent from this initial drug use escalating into a disorder or a dependency. It is that individual responsibility. How do we go about that? Number one, when prevention has been done and some people have somehow managed, or some people could not prevent from substance use, and then it goes to treatment. First and foremost responsibility is to acknowledge and accept that addiction is a disease. Let us stop stigma. Let it be an individual responsibility to know that somebody who is in substance abuse is sick and is likely, and there are chances that he can recover. I personally come out in the open and say I was in alcohol and drug use. I was in alcohol and cigarettes. And because of treatment, because of what we are discussing today, the evidence-based practices, I am here today. So I always try to imagine the people who talked negative about me. They stigmatized me. They felt that I should not fit. They didn't express. They didn't show love to me. I mean, okay, I'm a Christian and I know how to forgive, and I've forgiven them. But let us stop stigma. The other thing is, for each and every one of us to know the most powerful risk factors that can bring on board the problem of substance abuse, the risk factors that are involved in the problem escalating into a disease. Number one, it's very important for us to educate masses and tell them that there is that genetical predisposition. That awareness is very important. It is very important for me as Kibe and those others who are in recovery to know that there are chances that they could I can predispose the genes, the alcohol genes, to my children. So it is my responsibility to prevent from the initial use of substances for my children. It's also very important for us to know that there is a likelihood of comorbidity. What do I mean by comorbidity? I mean there are people who could be having mental problems, disease, mental disorders. Somebody could be schizophrenic. Somebody could have anxiety disorder. Somebody could have ADHD. And then this person uses substances. These are two problems that are aligned, and it can be chaotic, it can be really dangerous. And we should make sure that when it comes to treatment, Dr. Maina and my brother Xavier, it's very important for us when we are doing the diagnosis to take responsibility and diagnose and get the actual problem. Number three, it's our responsibility to bring up our families uprightly. Let's stop family neglect. Let's stop family abuse. Let's have a well-bonded family that is strong, because I normally say that the family is the most basic unit in a community. And if we get our families right, then the society will be clean. A few days back, we were discussing about the gender-based violence. We were talking about sexual and gender-based violence. This gender-based violence and the violence in our families, they are the factors, they are the risk factors that lead somebody to engaging in substances, because during the formative years, there was that psychological disturbance. Number four, and final one, is the attachment in our communities. What do I mean by communities? What is the relationship between our children in schools? What is the relationship between our children in the churches? What is the relationship of our workmates at our workplaces? All these are our responsibilities, and take it from me that you cannot be a change of what you don't want to see. What am I saying? Be the change that you want to see. Back to you, Katinda.
Thank you. Thank you. You know, I know for sure change starts with us. We are the
Yes.
example of what change looks like. So, as an individual, like you said, Edwin, that's where it starts. We can't always expect it to be the other person. We have to be the example of what change looks like. Now, Cosmos, you're nodding. Would you like to add something to that?
Actually, also I wanted to add that in our programs in Kenya, we also have what we call school programs. These are school-based protection, the prevention programs, and we have three types that we do so much. The three types of programs are: number one, the universal program. The universal program has the following approach: it addresses risk and protective factors common to all children. This can target all the school settings, whether it is the primary school or the secondary school, and also the community. No, mostly the school, not the community. At the universe, and then number two, we have what we call a selective program. A selective program is actually a protective program, is actually the one that targets the selective targets the young children or youth who have already experimented with drugs or are having a problem with drugs, and therefore we can be able to help them. And then the last one is actually the indicated program that is designed for the youth that are already deeply, completely into drugs. And this one indicated program can even help them when it comes to issues of rehabilitation. So it is at this stage of indicated prevention program that we can be able to take such young people to rehabilitation or places of help for recovery. Thank you.
Thank you, Cosmos. Xavier, did you have anything to add on to that before we move on?
KB, Dr. KB and Cosmos has said all, or very much more on that. So to save our time, I would like us to go to the next question for the day. Thank you.
Thank you very much. Okay, now this is our last question. What would you like our viewers to do starting today to help themselves or to help someone else who has a chemical addiction, or as a matter of fact, any sort of addiction that is not healthy for their well-being? Cosmos, you can start.
Actually, what I will advise for people, and I think also my second, Mr. Kibe said this, I think the issue of stigma in the community for people who use drugs is really harming them because when we stigmatize people who use drugs, we are making them run away from help and treatment. And therefore, I will ask any viewer who's watching, any viewer who's listening, that love for the people who use drugs. We should love them, we should care for them, and we should take them as a part of ourselves because they are with us in the community, and we should by no means stigmatize them, and we should always keep encouraging entry into treatment and care for them. And where possible, I also ask the government to provide more treatment centers so that availability of treatment centers will always be there when one needs to reach out for them. Again, also, I'd also like to wish that most of us could be able to allow in our community the alcoholic and narcotic anonymous programs that can help most of the affected users. Thank you.
Thank you for that. Thank you. Thank you. Well, also there's the Ubuntu. You know, being African, we believe in Ubuntu. So yes.
Okay.
Xavier, would you like to add?
Okay. Speaking about chemical addiction, I would say that anyone hearing our voice out there, if you come in contact or you have someone that uses chemicals or other substances and is addicted to it, here in Nigeria, at least we have drop-off centers in almost all the states, almost all local governments. Just simply advise, try as much as possible to, tell the person why he or she should go for treatment. That is a very nice step to take. There we have rehab centers, and with the help of very many international organizations, rehab centers or treatment for drug addiction, is very easy. And in fact, there are compensations as well. So I strongly advise everyone hearing our voice to please, act as a mediator between, the drug user and the rehab. Try as much as possible to link them up to go for treatment. And secondly, in the community, that's the social aspect, the stigma has to be reduced. We should stop stigmatizing these people. They might want to go for this treatment, but the stigma alone, will just pull them to keep short and continue in their advice, ways. So the stigma has to be reduced. We should stop stigmatizing, these addicts. Just like HIV patients, because of the stigma that will be attached to them, they feel comfortable living with the disease and not telling others, or are not sure, not going up for treatment. So the stigma has to be reduced. Then in the family, we should care for these people. We should show them love, show them care. You cannot. While I was going for my industrial training, one thing I was taught, just try to be polite with these people. For a schizophrenic patient, or other mental ill health, sufferers, try as much as possible to be friendly, to be polite, to be playful with them. This is the only way you can talk to them and they listen to you. And as well, that's the only time they can speak, they can open up their problems to you as well. So it's not about us, pushing them out. We should try as much as possible to bring them to ourselves. We should bring them closer, show them more love and more care. That is when they will listen to us, and when we speak, and that's when they will adhere to our instructions and go forward for treatment. And but when that is done, we see that the rate of of addiction in society will reduce. And lastly, as school systems, should also have should also help us in playing a very nice role. As students, are young people in the society, has to be taught coping mechanism. That is one big problem. People, young people, they believe that the only way to cope, with a problem, or with a stressful issue, is just by taking drugs. So our school sector has a very big role to play, and I thank God for the programs we are doing over here, sensitizing students in different schools, in different, health school institutions, to know the different mechanisms, different ways of coping with these issues when they arise. So also our teachers, our tutors in school should also help us and make this a success. Thank you so much. Thank you,
Thank you.
Katinda.
Thank you, Xavier. Well, I like that one about judgment, because a lot of people, the stigma is attached to judgment. And when you judge other people, you're not actually supporting them. You're making them stay away from help because they feel judged, and it's not a very good thing. Thank you so much. Edwin, what would you say?
Uh,
What do you say with this? What should
Thank you,
they do?
thank you very much, Katinda. What is the message to the people who are viewing, who are watching us? What is the takeaway? I would start by saying that self-awareness is very important at individual level. You have to start with you, who you are. I remember in the beginning of every session for this Jimha, Katinda normally asks us, "How are you feeling today?" That is very key, very, very important. Master your feelings. Master, get to know, are you in the mood? Can you easily be triggered to get angry? Are you get to know who you are? Self-awareness in all aspects. Then number two, get to master that emotional intelligence. Get to know when I can be easily, how can I easily go off the track? What can make me angry? What can make me to get angry such that I'll seek solace in alcohol or in other substances? That is the individual, that personal competence. Get to equip yourself with the relevant skills that can help you. My brother talked about judgment. It's very good to have rightful judgment, decision making. All those are in self awareness. That is the individual responsibility. Number two, for the people who are following us and people who are going to see this after we are done, and for everybody, let everybody play his rightful role. Do what you're supposed to do and do it well. That is the responsibility. That is the level of maturity. I mean, be responsible and think about the future. Think about, express that love and care, and know that you are nurturing, as for our children, you're nurturing them for a better tomorrow. What am I saying? Educate. The information that you collect from such forums, always make sure that you disseminate it. Let it reach to the grassroots. Like now, when I'm through with this one, I'll go and revisit it and pick one or two, three things and go and apply them in my local settings. That is my take to that. Finally, let people know that addiction is a disease. And once they realize and accept that it is a disease, it has signs and symptoms, it has treatment, it is manageable, they should feel free to come and seek for it, come and look for it. There is help. We are here. Effiong is there. Dr. Maina is there. Katinda is there. Please share what you're feeling. Don't let something to pile up. Don't let something to build up. Always share. And I know we are going to change. Once you change, you affect. It should be something contagious. Move it to the next person, and gradually. Today it may sound like it's a drop in the ocean, but in actual sense, Dr. Maina is in Mombasa. I am in Nairobi. Katinda is in Melbourne, and Effiong is in Nigeria. You never know. The impact can be awesome. So just do what you have to do and do it well. Back to you, Katinda.
Thank you. Thank you. I'm a very big believer for people asking for help. I believe the support systems that are out there, there's everybody. And I don't believe if anybody was to ask for help, anybody would turn them down. That is a very difficult thing for any human being to do. So if you're watching this, if you know someone, if it's you, please reach out, get some help for whatever it is, because we are here. And this is the reason why we're doing these forums, like Edwin is saying, to support you, to give you the information you need so you can make a decision to help yourself become a better human being. Now, before we finalize, I always like to check in and ask, what are some ways, each one of you, what are some things you do every day to protect and manage your mental health and well-being? Just maybe one thing that you do. We'll start with you, Cosmos.
So one thing that I like doing is actually to just watch cartoons.
Sorry, we didn't hear that. Watch
I
cartoon.
like to watch cartoons, yeah, in the evening when I come back home. Also, I engage my family so much. I have a young son who's at home this time of COVID, and so I like talking to him, ask him what he's been going through. At times, this helps me also to just maybe burn out because I actually work in a drop-in center where I see drug users every other day. And therefore, every time I go home, when I see family, then again I come to a family, to the realities of life, and that's how I do it. I unwind myself. But I love cartoons so much since I was young, and I think this helps me because we do it with my son and my family. So everybody wonders when I say I'm watching cartoons at my age, it looks funny, but that's the way I do it. Thank you.
That's actually a very good thing because you're bonding with the family. And that's one thing a lot of people who are busy don't do.
Yeah, yeah.
So that's amazing. And also, that's why I asked this question, because being professionals in this field, we need to also check in with our mental health. Just because we're professionals doesn't mean our mental health is not at risk.
Very
Yes. Okay, Xavier, how about you? What's something you do for yourself every day to check in with your mental health and well-being?
Okay, what I do personally daily to make sure that I am stable mentally. First, every morning I set up realistic goals. They are not too much, very simple goals in which I could, achieve these goals every day on a daily basis. And some people would tend to set complex goals in which they themselves they know that they can't achieve this, and they'll set those goals. And at the end of the day, at the end of the month, they have not been able to accomplish this, and it tends to backfire them to bring so much problems, emotional problems to them, a feeling of frustration and depression and the rest. So I said realistic goals of which I can achieve, and sometimes I don't. achieve all. But what do? I just believe that, oh, I'm gonna achieve this some other day. Thank God I've been able to achieve this one, this one, this one. So that is one thing that gives me joy every day. It makes me feel, I feel happy when I'm able to achieve one thing a day. Like today, being able to, show up in this show and contribute my quota for it. I'm happy I've achieved one thing, and that gives me joy, and that's what makes me, it makes my day already. So I get joy from little things, and by that I'm able to stay awake. I'm very, very good. And secondly, I value friendship so much. I have so much strong attachment to people, friends, and the rest. That is one way of, relieving or easing stress, emotional stress, and the tension everywhere. So that's one way I hang out with friends. After accomplishing what I'm supposed to do, the little time I have, I sit out with friends, my family as well, and we talk, we laugh, and we play also, and we also learn as well. That's one way of maintaining an optimal mental health. Yeah, thank you.
Thank you, Xavier. What about Edwin? What do you do to check in with your mental health on a daily basis?
Thank you, Katinda. This is a very good question, but I would want to approach it this way: that I'm a very positive person, and I apply a lot of positivism in everything that I do in life. I don't like associating with negative-minded people. I like handling or engaging with people like Dr. Mina, Xavier, and Katinda, positive people who can make an impact. At the individual level, in whatever I do, in all that I do, I always ask myself, is this the right thing that I'm doing? If my wife found me doing this, will be she okay? Will she be okay with it? My children, will they be my creator? So I try to be who I am and live positively, because I know history will judge me, and I want it to judge me correctly. Thank you.
Well, I think you're also accountable to yourself, really, because they say, you're a man or woman of integrity when what you do when no one else is watching is the right
Yes,
thing.
yes, yes,
It's not always about other people seeing you. It's what you do by
yeah.
yourself. When you look in the mirror, are you lying to yourself? Are you actually true to yourself? Because that
Yeah.
is super, super important. Now, as for me, I have a routine, which is I wake up really early in the morning. I always encourage everybody to have a glass of room temperature water and then meditate. That can vary from 5 to 20 minutes, depending on how much time anybody's got. Maybe do some physical exercise if you're able to. But the one thing that I have to do, doesn't matter whether it's whatever is happening, is do my gratitude journal. I have to say my gratitude because every day we are here, we are grateful to see another day. We are grateful to see sunshine. We are grateful to be able to be alive and healthy. And for example, now I'm so grateful that I'm sharing with you and I'm able to be in this forum, you know, empowering, inspiring people because there's someone's going to watch this and this will change their life. So this is the mission, to be able to be grateful for life and to be able to empower other people to feel the same and to feel amazing because that's why we're here. We're here as human beings. Our purpose is to help each other. That's why we're in this planet. So that is my motto. That's my routine. I just believe every day is a day to be grateful, no matter what the situation, and it always gets better. So it's always a mindset shift. You're gonna tell yourself that things are gonna get better if they're not that great. So where can people find you? So just give us one place they can find you, all of you. So Edwin, where is one place they can find you? What's your contact they can find you?
One place they can find me on Facebook, Kibe Edwin Getawa. Yeah, Kibe Edwin Getawa. That is applicable even on LinkedIn. Yeah, you can always find me or my website, uhaicenter.org. Sorry.
Thank you. Xavier, where can people find you?
People can always reach out to me through Facebook with the username Xavier Effiong as displayed on the screen. On LinkedIn, same thing, Xavier Effiong. Instagram, Twitter, everywhere. Through email with the address xaviereffiong11@gmail.com. So those are the ways in which you can reach out to me. All the social media platforms, I'm there with the name Xavier Effiong. Thank you.
Thank you. Thank you. What about Dr. Cosmos? Where can people find you?
People can find me. People can find me on Facebook also, using the name Cosmos W Minor in Facebook. Of course, on Twitter and also on the Dr. Cosmos Minor Foundation, again on Facebook, or they can find me on Gmail at zitocosmos@gmail.com.
Thank you. Thank you. So, and Edwin, where can people go to find GMIA, Global Youth Mental Health Awareness? Where would they go to get what's the information they need?
Global Youth and Mental Health Awareness. You can find that on Facebook. You can also get in touch with the director, Jude, at Professor Jude at I'm not quite sure. You'll help me in that one, Katinda. I didn't get the last
The
bit.
email address?
But Professor, but Global Youth and Mental Health Awareness, we are on Facebook. You can always find us there. And even after this presentation, we are going to respond to the questions and the messages and the comments, and we are going to assist you. This is a continuous thing. We really want to make a change in the lives of our people.
Yes. So about me, yes, go ahead.
Today we were discussing about scientific and evidence-based practices. Something very interesting happened yesterday, Katinda, in Australia. The National Health and Medical Research Council, it confirmed new national guidelines for reducing health risks from drinking alcohol. And I would want I would want to task you, Katinda, in our next session, you come and tell us what is new, because this has been replaced after 10 years. The previous version was in 2009. Maybe you go and do a little bit of research, and when you come next time, we discuss that one. That way we learn. Thank you, Katinda.
Sounds good. Sounds good. So for me, people can find me. My name is Katinda Dollar. You can find me with that name on LinkedIn, Facebook, Instagram, Twitter, Twitch, just any social media. Just type my name, Katinda Dollar. I will come up. So, and that's all for today. Thank you so much, Cosmos, Edwin, Xavier, for sharing your insights and shining the light on addiction and sharing the tools and strategies to empower families and communities to thrive and to become better than good. Thank you, viewers, for being a fabulous audience, for supporting us throughout these sessions and watching the Global Youth Mental Health Awareness Show. Well, it's that time of the year where I believe we all need to support each other. So happy holidays, stay safe, and remember, give love, share love, and be love, because it's that time when we all come together to celebrate each other's brilliance. And remember, love is always the answer. Merry Christmas and happy, prosperous New Year. This is our last show for this year, and we'll see you in 2021. Bye for now.
Thank you. Thank you. Merry Christmas, everybody.
Bye. Merry Christmas, everyone. Bye.
Merry Christmas. Bye.
Just stay a little
Bye,
bit.
everyone.
We're waiting for it to go off and then we can have a quick chat. Okay. Waiting for Jude to finish this.